So in this short video, we will cover what are the boundaries of the suboccipital triangle and where exactly the suboccipital triangle is located. Again, we will go through the various contents of the triangle and its clinical application. So the suboccipital triangle, as the name suggests to you, that is located in the suboccipital region. So this is the occipital region. So this you can consider as suboccipital region. So here we have a small muscular triangle. By definition, this is a muscular space that is located in a deeper aspect of suboccipital region. So this triangular region is located in a deeper plane, deep to other muscles. And let us consider what are the boundaries of this triangle. This is the superomedial boundary. So superomedially you can consider a muscle called as rectus capitis posterior major and also rectus capitis posterior minor. So the main contribution is rectus capitis posterior major muscle. And again superolaterally, here you have another muscle called as superior oblique capitis and inferiorly inferior oblique capitis. So this is this small triangular region called as suboccipital triangle, called as suboccipital because that is just beneath or at the lower level of occipital region. Let us consider what are the factors which are forming the roof. This triangle is covered by some other muscles. These are the semispinalis capitis. You can see here the cut portion. So this is our triangular area. So once this muscle, if you consider here in the roof portion, this muscle you can call as semispinalis capitis. And also you have another muscle called as splenius capitis. Semispinalis capitis and splenius capitis mainly. The floor of this triangle is formed by posterior arch of atlas. In this lateral view of the neck region, so here you have the masseter process. So this is the posterior aspect and this is the anterior aspect. You can see C1, C2, C3, like that the cervical vertebrae are here. So the first cervical vertebra, that is the C1, that got a posterior arch and an anterior arch. So this is the occipital region and this is our suboccipital triangular region. So the floor of this triangle is formed by posterior arch of atlas, that is C1. And there is another membrane called as posterior atlanto-occipital membrane. Atlanto-occipital membrane. There is a membranous structure extending from atlas to the occipital region. Exactly speaking, we have two atlanto-occipital membrane. Anterior atlanto-occipital membrane in front and posterior atlanto-occipital membrane behind. This membrane is attached or extending from the superior border of posterior arch of atlas and posterior margin of foramen magnum. So that is atlanto-occipital membrane, posterior atlanto-occipital membrane that form the floor of this triangle. Now all these boundaries you can compare with an original cadaveric picture here. So this is our occipital region, suboccipital region. Here you have the trapezius muscle. Deep to these muscles only you have in a deeper plane this small triangular region, suboccipital triangle. As we have seen earlier, this is the superomedial boundary. Okay. And again here you have superolateral and inferior. Okay, so rectus capitis posterior major and minor, and again superior oblique capitis and inferior oblique capitis. So this is the triangular region. Now let us analyze what are the contents of this triangle. So this triangle, suboccipital triangle, contains mainly three contents. Number one, third part of vertebral artery. Again, you have a nerve called as suboccipital nerve, that is the dorsal ramus of first cervical segment, and suboccipital plexus of veins. So these are the three contents to be explained in this suboccipital triangle. So first let us go through vertebral artery. The vertebral artery is arising from the cervical region. So this is a branch of first part of subclavian artery. This is the right subclavian artery, this is the left subclavian artery. The vertebral artery, after arising from the subclavian artery, that got various parts. So you can consider this picture. So the first part, this is the first part of vertebral artery, that is from the site of origin, that is from the first part of subclavian artery, that will reach to the foramen transversarium of C6 cervical vertebra. Then its course is upwards throughout the foramina transversaria of various cervical vertebrae, that will run upwards. Here also you could clearly see. So from the point of origin till this transverse foramen of C6 vertebra, this is the first part. The second part is ascending through the foramina transversaria. And again the third part, the second part will arch over the posterior arch of first cervical vertebra C1. Okay, then in the superior aspect of the posterior arch of the C1, we have a groove for this vertebral artery. This vertebral artery runs in that groove. Further, it will pass through the foramen magnum and enters to the cranial cavity. So after passing through the foramen transversaria of the C1 till it reaches to the foramen magnum, this you can consider as third part. So we got first part, second part and third part. And the fourth part is intracranial, that will enter or that will pass through the foramen magnum in order to enter the cranial cavity. And the right side vertebral artery and left side vertebral artery, these two are uniting to form the basilar artery. Further, this basilar artery divides into posterior cerebral arteries. And these courses and its branches, everything we have covered under a topic called as circle of Willis and the blood supply of the brain. So this is the story of vertebral artery, its origin, first part, second part, third part and the fourth part respectively. Next content to explain is suboccipital nerve. The suboccipital nerve is the dorsal ramus of C1, and this nerve is supplying to these muscles over these areas. So what is the dorsal ramus? So if you consider a spinal nerve, a spinal segment, a spinal nerve is attached to spinal cord via two roots. One is in anterior aspect, that is called as ventral root. Another is behind, that is in the posterior aspect, this is called as dorsal root. Both ventral root and dorsal root unite together to form a single spinal nerve. And this single spinal nerve will divide into two. One will go behind, that is called as dorsal ramus. One will come forwards and laterally. This is called as ventral ramus. So the ventral ramus will be targeting the anterolateral aspect, and the dorsal ramus will be targeting the posterior aspect. And here this is the thoracic area, thoracic vertebra and thoracic spinal nerve. You could see the ventral root and the dorsal root. Dorsal root will be possessing the dorsal root ganglion, and these two roots are uniting. Further, this single united part will divide into a ventral ramus that will come forwards and laterally, and the dorsal ramus that is going backwards to supply the muscles. The same picture, the same pathway you can expect even in the cervical region also. So this dorsal ramus of first cervical segment, that you can appreciate here in this suboccipital triangle. In the suboccipital triangle, this is also called as suboccipital nerve, and this suboccipital nerve is located between the vertebral artery and the posterior arch of atlas. Let us consider what are the factors which are forming the roof. This triangle is covered by some other muscles. These are the semispinalis capitis. You can see here the cut portion. So this is our triangular area. So once this muscle, if you consider here in the roof portion, this muscle you can call as semispinalis capitis. And also you have another muscle called as splenius capitis. Semispinalis capitis and splenius capitis mainly. The floor of this triangle is formed by posterior arch of atlas. In this lateral view of the neck region. So here you have the mastoid process. So this is the posterior aspect and this is the. Now let us see a clinical application of this suboccipital triangle. So there is a procedure called as cisternal puncture or also called as cisternal tap. So here once the lumbar puncturing procedure is failed, so that procedure can be to collect the CSF for therapeutic or for the investigatory procedures. So once the lumbar puncturing failed, next option is cisternal puncture. So we have the cisterna magna. So when we were talking about the subarachnoid space, so we have talked about the cisterna magna behind this brainstem. And from the cisterna magna we can introduce a needle and we can collect the CSF. So CSF can be collected by puncturing at the suboccipital triangle. So this is called a cisternal puncture. And the needle can be introduced in the midline of the neck, just above the spine of second cervical vertebra, that is axis vertebra. And this needle have to be passed through the atlanto-occipital membrane around 2 inch in depth. But here have to be careful in order not to damage the medulla oblongata. So this procedure is highly risky because any injury or damage to the medulla oblongata, that will be fatal, because there are the center, cardiac and respiratory centers are located in the medulla oblongata. So injury to these centers can be fatal. That's why this procedure has to be carefully done.